Okay, let's unpack this. We're diving deep today into something huge, something that impacts, well, pretty much everyone, everywhere. Non-communicable diseases, NCDs.
That's right. We're talking heart disease, cancer, diabetes, chronic respiratory issues. These aren't things you catch, they develop over time.
And they're a massive, growing global health challenge.
Absolutely. The scale is just immense. They account for such a huge percentage of deaths worldwide, really straining health systems and posing, big economic challenges too.
And our guide for this deep dive is a really critical report. The World Health Organization's Non-Communicable Diseases Progress Monitor 2025. It's a vital checkpoint.
Yeah, and it marks a decade since the world set some key goals. So this report tells us, well, where do we actually stand now?
So our mission today is to really cut through that data, pull out the key findings, and get a handle on the global picture.
Where are countries making headway against NCDs? Where are they struggling? And what does that uneven progress tell us about the path forward?
Right. And the report is pretty blunt about the core challenge from the start, isn't it?
It is. That global commitment made back in 2015 to cut premature NCD that's deaths before age 70 by a third by 2030. SDG target 3.4.
But progress is uneven. That's the headline. Some places moving forward, others actually seeing the burden rise.
Yeah, it's stark. But what's powerful about this report, though, is it doesn't just flag the problems. It lays out what WHO calls the best buys.
Ah, yes, the best guys.
These are cost-effective, evidence-based things countries can do. The report really argues that investing in these isn't just a health expense.
It's an investment, right, with real returns.
Exactly. Pays dividends and lives saved, economic benefits. It's a compelling case.
So let's start with that big picture the report paints. What's the overall global status, that mix of progress and the persistent challenges?
Well, the forward and intro set a clear tone. The challenge is massive, yes, but there is positive movement. Encouragingly, over 100 countries have actually shown progress on specific indicators since the last report in 2022.
Okay, so there's commitment translating into action in many places. That's genuinely good news.
It is.
Where specifically is the report noting the strongest momentum? Like, where are we seeing the wins?
Two areas really stand out globally. Tobacco control is one. And the other is strengthening clinical guidelines for managing NCDs, especially in primary care.
So policy on tobacco and tools for doctors. That makes sense.
It suggests many countries are prioritizing those levers.
Okay, so there's progress, but what's the flip side? Where are the major hurdles the report points to? What's holding us back?
The big concerns, and they are big, are the relentless rise in obesity and diabetes worldwide. These risk factors just keep trending the wrong way.
Still going up.
Still going up. And critically, despite progress in some areas like tobacco, overall premature NCD deaths are actually increasing globally.
Increasing, wow.
Especially in low and middle-income countries. This is the key number that shows we're still off track from that 2030 target in far too many places.
That's stark. So even with wins, the overall tide isn't turning fast enough, and premature deaths are rising where people might be most vulnerable.
Precisely. And the report also notes a slowdown in some pretty fundamental activities, which is worrying.
Like what? What slowed down?
Progress has stalled recently in areas you'd think would be basic. Setting specific national NCD targets, for one.
You need targets.
You do. And importantly, conducting regular risk factor surveillance, basically, knowing how many people have high blood pressure or bad diets or aren't active enough.
Finding out the scale of the problem.
Yeah, and running widespread public awareness campaigns has also slowed down.
That seems counterintuitive. If you know you have a problem, you'd want to measure it and tell people about it, right?
You'd think so. It really underscores that NCDs aren't just a health sector issue. The report frames them as a critical development priority.
Right, impacting everything.
Exactly. Building resilient health systems, fostering sustainable economic growth, it's all deeply intertwined with tackling NCDs. The evidence presented is strong. These are high-return investments.
Not just costs. Investing here saves lives, keeps people productive, reduces future healthcare burdens.
Absolutely. So the report isn't just data, it's positioned as a powerful call to action.
A call to action. I like that.
Precisely. It emphasizes that turning global commitments and knowing the best buys into actual results on the ground. Well, that takes bold leadership.
It's in collaboration.
Real collaboration across different government sectors, absolutely. And clear accountability. It's about implementation, not just good intentions.
So how does the report actually track this implementation? It uses a specific scorecard, right? Those 11 indicators.
That's right. To monitor how well countries are putting those key, proven interventions, the best buys, into practice, it uses 11 specific progress monitoring indicators.
And these aren't about health outcomes directly, like death rates.
Not directly, no. They're about whether the right policies and systems are actually in place. The building blocks, essentially.
And these indicators cover the whole spectrum of NCD control.
Yeah, pretty much. They cover foundational stuff like planning and data, having targets, tracking deaths reliably, running surveys, having a national plan.
Not basics.
Then they cover key risk factors, policies on tobacco, alcohol, unhealthy diets, physical activity. And finally, the healthcare response clinical guidelines, access to essential medicines, HPV vaccination.
Okay, quite comprehensive. And the report classifies how countries are doing with those symbols, like circles.
Correct. Simple visuals. A filled circle means fully achieved. A half-filled circle, partially achieved. An open circle, not achieved.
Easy to grasp.
Yeah, and then there are little notes for missing data or if an indicator isn't applicable. But understanding that system helps you see the patterns, and it's those patterns that really tell the story of the uneven progress.
Right, the patterns. So let's look at how these indicators play out in the real world. We can use some country examples from the report, starting with those foundational building blocks.
Okay, so those first few indicators, number 1, having national targets. 2, reliable mortality data. 3, doing risk factor surveys. And 4, having a multi-sectoral NCD plan. These are absolutely fundamental.
The bedrock.
Pretty much. If you don't have these sorted, it's really hard to know the scope of your problem or coordinate an effective response.
And the report flags that global progress has actually slowed on setting those national targets and doing the risk factor surveys. That's concerning.
It really is. It means some countries might be sort of flying blind.
You can see this in the country profiles, can't you?
Definitely. Take Armenia, for instance. The report shows they have targets and surveys, but they're marked as only partially achieved that half circle.
Right.
Whereas their mortality data and overall plan get the full circle, fully achieved. So even when the foundation is mostly there, specific gaps can exist.
Or look at Burkina Faso. They have targets, surveys, a plan. Looks good. But their mortality data has that little asterisk next to it.
Right, meaning the data might underestimate the true number of NCD deaths. That highlights a huge challenge in some places just getting reliable death registration data, if you don't know how many people are dying from NCDs.
Hard to prioritize, hard to track progress.
Exactly. And then you see a country like Congo looks strong on paper for those first 4 indicators all fully achieved, full circles.
Seems solid.
But then later in their profile, when you look at their alcohol policies, the data source is marked DK don't know.
A blind spot.
Yeah, even countries with a seemingly solid foundation can have specific data gaps elsewhere. It's complex.
Okay, moving on to the actual policy interventions, the best buys happening on the ground. Tobacco control is highlighted as a global success story.
And the indicators show why. It tracks things like raising taxes, creating smoke-free public places, strong packaging warnings, ad bans, mass media campaigns. Lots of action here globally.
You see countries like the UK or even Somalia listed as having fully or partially implemented most or all of these specific tobacco measures. Full or half circles across the board.
It really shows that sustained, multi-pronged policy action can work. It makes a difference.
But it's not universal, is it?
No, definitely not. Tunisia, for example, shows a mix, some full circles, some half circles across those same 5 measures. Progress is happening, but consistency and hitting that top level of implementation isn't everywhere.
Okay, what about harmful alcohol use? Another key risk factor. The indicator looks at restricting availability, ad bans, taxes.
The picture here is much more varied globally. Cuba, for instance, shows partial achievement on a couple of measures, full on one. Brunei Darussalam is marked NA not applicable, likely due to national laws.
Right.
And Uzbekistan shows partial progress, those half circles, on several alcohol measures. This area seems more complex, maybe facing different cultural or economic hurdles compared to tobacco.
Unhealthy diet seems even more complex. Indicator 7 covers 6 different things. Reformulating foods, front-of-pack labeling, public procurement rules, marketing to kids.
Yeah, a whole suite of actions. And the report shows a really wide mix of implementation here across countries. Armenia shows progress on several measures, some fully, some partially.
A real mix.
Brunei Darussalam is mostly partial achievement. Japan shows solid progress, several full and partial circles. It highlights that tackling unhealthy diets needs a broad approach, and countries seem to be picking and choosing which bits they prioritize or find feasible.
And the final risk factor area is physical activity. Indicator 8 tracks national awareness programs, including mass media.
This seems to be an area where many countries have taken action. A large number, including places like Armenia, Cuba, Somalia, the UK, they get the full circle fully achieved for having these programs.
So getting the message out is common.
Yeah, though implementation varies. Others, like Brunei and Uzbekistan, show partial achievement, the half circle. So public awareness is a common strategy, but maybe not always at full intensity everywhere.
Okay, shifting gears now to strengthening the actual healthcare system response. Indicator 9 looks at clinical guidelines for managing the 4 main NCDs in primary care.
Yeah, having clear evidence-based guidelines is just foundational for doctors and nurses to provide effective care. You need that standard approach.
And how do countries stack up here?
Pretty well in many cases. Countries like Armenia, Brunei, Japan, the UK, Uzbekistan, they report having guidelines for all 4 main NCDs, so they get the full circle.
That's good.
Others like Cuba, the Republic of Korea, Latvia show partial achievement. Maybe they have guidelines for some, but not all 4 yet.
Indicator 10 zeroes in on essential medicines and technologies, specifically for chronic respiratory diseases in primary care, like inhalers.
Exactly. Things like having peak flow meters, steroid inhalers, bronchodilator inhalers readily available, basic tools.
And the availability.
Encouragingly, many countries report full availability, getting the full circle mark. That includes Armenia, Brunei, Cuba, Japan, the UK, Uzbekistan. Suggests decent access to essential respiratory care in primary settings in many places.
But not everywhere.
Not everywhere. Some, like Kiribati and Sao Tome and Principe, only report partial availability, the half circle. That highlights potential access gaps, which can make a huge difference for patients.
And finally, Indicator 11 covers the HPV vaccination program. Crucial for preventing cervical cancer. It looks at inclusion in the national schedule and coverage levels.
Right. This is a key prevention strategy. The report shows varying progress. Countries like Armenia, Brunei, Japan, Republic of Korea, UK, Uzbekistan all show partial achievement.
Meaning
Meaning the vaccine is in the national schedule, which is great, but the coverage is below the 90% target needed for that full circle.
Okay. Rollout is happening, but not reaching enough people yet.
Exactly. Though some countries, like Cuba and Sao Tome and Principe, do report full achievement with high coverage. So it's possible, but the global rollout still has work to do on boosting coverage.
Looking at these individual pieces is useful, but seeing how they combine in different countries really brings the picture to life, doesn't it? The report includes country snapshots that do just that.
They offer a really compelling contrast, yeah. Take Japan. High percentage of deaths from NCDs overall, 85%. That sounds bad initially.
Right.
But they have a very low risk of premature death from NCDs, only 8%. And most of their indicators are fully or partially achieved, lots of full and half circles.
So what does that tell us?
It suggests that while NCDs are common, maybe reflecting an older population, their health system is effectively managing these conditions to prevent people dying young from them. Good treatment, good management.
Now contrast that with a country like Kiribati. Lower percentage of deaths from NCDs, overall 66%. But a dramatically higher risk of premature death, a staggering 44%.
And when you look at their indicator profile, many are marked as only partially achieved, half circles, or have those asterisks indicating data issues.
A very different picture.
A completely different picture. It paints a clear story of a country facing significant challenges across the board in prevention, in data, in providing adequate care, leading to that tragically high probability of people dying young.
India, as a huge country, presents another kind of profile. A massive burden. 49% of deaths from NCDs, 24% risk of premature death.
And their indicator performance is really mixed. You see progress in some areas, but clear gaps in others. It just illustrates the sheer scale of the challenge in a massive, diverse population.
Implementing comprehensive strategies consistently across such a country must be incredibly difficult.
Absolutely. And one more example, Fiji, high premature death risk, 38%. Their profile shows a mix of achievements, but also several indicators marked NR, no response.
No response, meaning they just didn't provide the data.
Exactly. And that NR is critical because it highlights data gaps alongside any implementation challenges. If you don't even know if a policy or service is in place.
You can't track progress, you can't target interventions.
Precisely. And those asterisks we mentioned earlier are next to some countries' death data, indicating potential underestimation due to unreliable systems. It's another reminder of these fundamental data complexities.
So we've dug into the global picture, the scorecard, the specific actions, and seen how it plays out differently through these country examples. This isn't just abstract stuff in a WHO report somewhere. Why does this matter to you listening right now?
Well, it matters immensely because these global trends and these country-level policies directly influence the health environment where you live. They shape the choices available to you, the air you breathe, the food standards, the health care you can access.
Decisions about tobacco taxes, food labeling, access to medicines, they aren't just lines in a report. They shape daily life and, ultimately, health outcomes, yours and mine.
Absolutely. And understanding this report gives you a really grounded view of the scale of the NCD challenge, but also, and this is important, it highlights that we do have proven tools, those best buys. We know what works.
And the report hammers home that these interventions aren't just clinically effective, they're cost effective.
Right? Extremely. Tackling NCDs is presented as a necessary investment, not just an expense. It yields huge returns in human well-being, keeping people healthy, productive, reducing future healthcare costs. It's good economics, basically.
Knowing where progress is happening, like, okay, tobacco control seems to be moving globally versus where it's lagging.
Like that worrying, persistent rise in obesity and diabetes.
Yeah, that provides crucial insight, doesn't it? It shows where global health priorities need to be focused, where sustained, maybe even more aggressive effort is desperately needed.
We have the blueprint, the roadmap exists, but actually building the structure everywhere consistently, that's the hard work still ahead. It's a clear picture of having the map, but needing the collective will and resources to follow it universally.
So, to wrap up, the main points are, progress against NCDs is real, but it's inconsistent, it's patchy. The WHO's monitor gives us a clear picture of where countries stand against these key evidence-based actions.
The roadmap, the best buys, the indicators it exists, but translating it into full implementation and crucially improved health outcomes, that remains the ongoing challenge.
And this report, as you said, is quite literally titled A Call to Action. So, given the uneven progress we've talked about, that concerning rise in premature deaths in some places, and the fact that we're already well on the way to that 2030 deadline, here's something maybe to leave our listeners thinking about.
Okay.
What specific actions, maybe going beyond just implementing the current best buys list, or perhaps finding ways to dramatically accelerate their implementation, are needed right now to actually save more lives and truly bend that curve before the deadline hits? What's the next leap forward?